Okay, so good afternoon. It's a pleasure to be speaking here today. I'd first like to thank the organizers for inviting me to present my work on HIV testing and counseling among people who inject drugs in Thailand. I'd also like to acknowledge my co-authors, including our partners in Thailand, who have contributed greatly to this work. By way of background, data from the Ministry of Public Health Thailand have shown persistently high rates of HIV infection among people who inject drugs in Thailand, or IDU. As this figure shows, the HIV prevalence rates among this population have been consistently between 30 to 50% over a 20-year period, while HIV prevalence among other risk groups, including commercial sex workers, have been declining over the same period. And as you all know, HIV testing has many benefits on its own, but in the context of seek and treat initiatives, it's useful to note that testing can also accelerate access to HIV treatment among IDU, as shown in this figure, which is derived from a study involving IDU in Vancouver. Despite the known benefits of HIV testing, the available evidence suggests that the uptake of testing among IDU in the Asia-Pacific region are less than 20%. There are some known barriers to HIV testing that Thai IDU face. In particular, the continued reliance on drug law enforcement approaches has forced many IDU into hiding and have restricted their access to public health programs. For example, the 2003 War on Drugs campaign that was initiated by then Prime Minister Thaksin Shinawatra resulted in mass incarceration and extrajudicial killings of IDU. Unfortunately, this policy approach has since been embraced by successive Thai governments. The reliance on this approach has also given rise to the high rates of stigma and discrimination among IDU, as well as breaches of patient confidentiality, as some health authorities routinely share information concerning suspecting drug users with the police. So the work that I'm about to share with you today is focused on the seek and test components of the broader approach. In particular, we aim to examine HIV testing behavior among Thai IDU and to explore the acceptability of novel methods of testing and counseling, including VCT that's delivered outside of traditional healthcare environments, as well as peer-delivered VCT, and that is testing and counseling that is delivered by a former or current drug user. The MITSAMPAN Community Research Project is a collaborative research effort involving the British Columbia Center for Excellence in HIV and AIDS, the Urban Health Research Initiative, the Thai AIDS Treatment Action Group, the MITSAMPAN Harm Reduction Center, and Chulalongkorn University. The MITSAMPAN Harm Reduction Center is a project of the Thai AIDS Treatment Action Group and is a drug user-run drop-in center that provides health education and harm reduction services to Thai IDU. To overcome some of the barriers involved with conducting research with this heavily marginalized population, we employed a community-based research approach that involved local IDU in all stages of the project. More specifically, former and active drug users were trained as peer researchers who conducted outreach, administered surveys, and also assisted with the dissemination of our research findings. We have completed 3 cross-sectional studies to date over a 4-year period. So this is a photo of the MITSAMPAN Harm Reduction Center where most of our work was carried out, and this is a photo of the peer research team from 2009. In terms of methods, IDU were recruited through peer outreach and word of mouth, where they completed an interviewer-administered questionnaire that addressed a range of topics, including access to HIV testing and treatment. To be eligible for participation in the study, individuals had to have injected drugs within the previous 6 months, reside in Bangkok or adjacent provinces, and provided oral informed consent. Data for these analyses were collected in 2009 and 2011. And given that our focus was on testing, we restricted our sample to HIV-negative IDU or IDU of unknown HIV serostatus. So the first study, which as of today has been published in BMC Public Health, looks at HIV testing behavior and willingness to get HIV testing at a peer-run drop-in center, which in this case was the MITSAMPAN Harm Reduction Center. Among the 244 individuals that were included in the study, 76% had tested for HIV in the previous 6 months. In bivariate analyses, those who were enrolled in voluntary drug treatment or enrolled in the tenofovir trial were positively associated with having been tested recently. Among those that were not tested for HIV in the previous 6 months, which was 24% of the study sample, 66% said that they didn't take an HIV test because they believed that they were HIV negative. However, a concerning finding was that 57% of those who haven't taken an HIV test in the previous 6 months engaged in some form of high-risk behavior. Our study also found that 74% of the study sample were willing to receive free HIV testing at the MITSAMPAN Harm Reduction Center. And in multivariate analyses, having ever been to the MITSAMPAN Harm Reduction Center was positively associated with willingness to get tested there. We also did a test of interactions and found that among females, those who were enrolled in voluntary drug treatment were more willing to get tested at the MITSAMPAN Harm Reduction Center. Our next study focused on HIV test avoidance among IDU in Thailand. And we found that 13% had reported avoiding HIV testing. And avoiding HIV testing was positively associated with male gender, a weekly heroin or midazolam injection, syringe sharing, noticing increased police presence within drug markets, having ever been refused healthcare services by healthcare providers, and was negatively associated with having ever received a hepatitis C test. This last analysis looked at willingness to receive peer-delivered HIV testing and counseling among Thai IDU. And we found that 44% were willing to receive peer-delivered pre-test counseling, while 38% were willing to receive peer-delivered rapid HIV testing, and 37% were willing to receive peer-delivered post-test counseling. In multivariate analyses, we found that factors that were positively associated with willingness to receive peer-delivered pre-test counseling included binge drug use and barriers to accessing health services, while male gender was negatively associated with the variable. Factors positively associated with willingness to receive peer-delivered rapid HIV testing included binge drug use, barriers to accessing health services, a history of incarceration, and having ever been to the MITSAMPAN Harm Reduction Center. Not surprisingly, those who avoided HIV tests were less willing to receive peer-delivered rapid HIV testing. And lastly, factors that were positively associated with willingness to receive peer-delivered post-test counseling included binge drug use, having ever been incarcerated, and was negatively associated with avoiding HIV tests. And as shown here, we see that there's some consistency in terms of the variables that predict willingness to receive HIV testing and counseling through peer delivery. So in summary, we found a high prevalence of HIV testing among Thai IDU, with over 3/4 having been tested in the previous 6 months. This appears to be explained in part by the existence of the CDC-sponsored tenofovir trial that's operating in Bangkok. As well, within some drug treatment centers, HIV testing is a prerequisite for receiving services. It should be noted, however, that the tenofovir trial is scheduled to end this year, and accordingly, there is a need to consider how low-threshold community-based testing programs may address gaps in testing that may occur in the wake of this trial. Our findings also point to the need for ongoing HIV prevention education efforts for IDU, including information about HIV risk and transmission. These efforts should focus in part on IDU who have not been tested and those who avoid HIV tests, as many of these individuals continue to engage in high-risk behaviors. Collectively, these data raise the question as to whether it is time to consider more novel approaches to VCT for IDU in Thailand and elsewhere. Our findings provide evidence for this, given that a substantial proportion were willing to get tested at a drug user-run drop-in center. In addition, our findings suggest that peer-delivered VCT for IDU has the potential to reach vulnerable groups who do not access conventional public health programs, including those who are previously incarcerated, those who engage in high-intensity drug use, and those who report barriers to accessing healthcare services. So to summarize, the limitations of current HIV testing approaches in Thailand have been described and include the high level of discrimination that IDU face within healthcare settings. In addition to the need for ongoing HIV prevention education efforts for Thai IDU, our findings also point to the potential of novel approaches to VCT for IDU, including the provision of HIV testing services within peer-run harm reduction centers, as well as peer-delivered VCT. So I'd like to just conclude by acknowledging the participants in the study and to our community and academic partners. Thank you.